afternoon. My name is Dr. Ralph Stewart, and this man beside me is Stanley Hicks. We're here to discuss how the Chattanooga decompression and traction system has worked in Stan's particular case. Now, first of all, Stan, are you receiving any kind of compensation for this interview right here?
Nope.
Okay. Okay, Stan, you became a patient of mine along with the rest of your family in about 2004. Well, your wife was actually a little bit previous to that.
Right.
But is that correct, about 2004? Okay. And at that time, you were suffering from some mild to moderate low back pain,
Right.
which would come and go. Is that correct?
Right.
Okay. Now, almost a year ago, Stan, something else happened. Would you mind telling us about that, please?
Well, I got a lot of back pain, and after going to a specialist, Dr. Berrien, they done an MRI and discovered that the L4 and 5 had a protrusion of about 1 centimeter.
Okay.
Since then, I've had a second MRI, which shows that the protrusion has grown to about 5 centimeters.
Okay. So it more than quadrupled in size, is that correct?
Right.
Okay. And would you describe for us the kind of pain you were having at the point of the second MRI?
On a scale of 1 to 10, which everybody wants you to rate, it was 9 and 10 most of the time. It got so bad I even used crutches.
Okay.
Because I couldn't put no weight on them.
Okay. And how was that affecting your life? What kind of things were you generally used to doing that you can no longer do at that point?
Well, just about everything. I even had a hard time getting dressed.
Okay.
Get out of bed, take you 10 minutes to get limbered up enough to move.
Okay.
You know, it just changed everything. Your whole life, your whole outlook.
Mm-hmm. So, needless to say, at that time things were looking pretty grim.
Yeah.
Okay. All right. What other forms of treatment have you tried, Stan, up to this point?
Oh, they put me in therapy, physical therapy. They've given me, I think it's been 6 shots in the back.
Okay, those were like an epidural block or corticosteroids?
2 of them was steroids, and 2 of them was the epidural block.
Okay.
Actually, there's been a third one because the 2 times that I went to the hospital and received pain shots, then the very next week they give me a third one.
Okay. And how did these work for you, Stan?
It's just that they blocked a little bit of the pain, maybe I'm going to say 40% of it, enough that I could get around a little bit, but then it turned around and got worse again.
Okay. And so you had the physical therapy, the epidural blocks. Was there any other forms of therapy?
At that point, no.
Okay.
No.
And so what were the doctor's conclusions at this point? What were they saying to you after these steroid shots? Did they want to continue that regimen? Did they want to do something else?
They was talking about doing a series every 2 weeks, 3 shots, and then talking about going in right in the center of the disc and sucking some of the disc out to try to shrink it back up to get it off the nerve.
Did you and the doctors at that point talk about any risks associated with that?
Yeah, in Dr. Berrien, the only thing he can say is that when they do any kind of back surgery, the only thing they can help is any pain that goes down your leg from this disc being on the nerves.
Okay, so they really can't do anything with the back pain, just
They
can help the leg pain.
That's
Okay.
it.
Okay. Now, I had told you about the DTS system, the decompression traction system, sometime during all this, and that I thought it might help you, right?
Right.
Do you recall that?
Yep.
Okay. What were the doctors saying anything more about your options at the time? Were they even considering doing surgery on you?
No.
No, because you weren't a candidate for surgery, right?
Right.
Okay, because of other issues.
Other issues.
Okay. So basically, if this didn't work, you didn't really know
Which way to go.
where you would be going.
Right.
Then, okay. Not that there wouldn't have been something else, but we just didn't know. And so we began the disc decompression therapy with Stan here on the 6th of February. Is that correct, Stan?
Yes.
And how has your life changed as a result of those treatments?
Well, outside of not lifting and, just taking it easy, it's been a complete turnaround.
Okay.
Very little pain. There's no back pain. Any pain I have is in the leg area, and it's still from the disc putting a little bit of pressure on. But the pain is, 1,000% better.
Okay. So the back pain is all but gone.
Back pain's all but gone.
And how has the leg pain changed compared to what it was?
Before we started the compression, it was running 5 and 6 on a scale of 1 to 10. Right now, I'd say it's averages less than 1.
Okay. All right. And have you been able to pretty much resume most of your basic activities? We know you can't work yet. After all, it's only been a few weeks here.
Right. Yes. I get up, I walk around, I play with the dogs, I do a little gardening with the roses, and I just take it easy.
Okay.
I still no lifting. Anything that has to be lifted, I just wait till somebody else comes along.
Mm-hmm. Okay. And it's useful to note I threatened Stan within an inch of his life on this too. So, okay, Stan, when you went back to the orthopedist this last visit, what was his reaction?
He couldn't believe it. He couldn't believe that the pain just the decompression had relieved it so much, although it works both ways. He tried to get a traction device that they quit making 20 years ago, and he wanted me to do it, something that you tie yourself to and throw the weights over the end of the bed. Nobody had anything like that. So consequently, we just waited till we got your table.
Okay, so he was thinking about the traction alternative before we got started on the table.
Right.
Is that correct?
Right.
Okay. So that made sense to him.
Yes, it did.
But he was he was pretty amazed, wouldn't you say, that that you had changed? I mean, just to illustrate for a moment, when Stan first came in, his torso was bent to this degree. Stand up for me, Stan. Okay. As you can see now, he's pretty well straight up and down if we didn't chop his head off here. Go ahead and sit down, Stan. And he was interested. He knew that there was only a couple of guys in town that had this machine, right?
Yep. Yes, he did.
Okay.
And as of yet, he hadn't suggested it, because his little traction device was something you buy that you could use 3 or 4 times a day. Is what he was wanting.
Okay.
And you added weight to it. Basically the same as your decompression machine, except he was wanting something that you could do more often.
Right. Right. Okay.
Consequently, nobody has it.
Is there, Stan? That's basically what we wanted to accomplish here. Is there anything else you'd like to add?
It's just amazing what the machine's done, compared in pain-wise, compared to what it was, 6 or 8 weeks ago. What if I had 6, 7 treatments? I walk straight, very little pain. When I go in, before I'd go in the house at noon, I didn't go back outside. I didn't get up and do nothing because it hurt too bad. Now I spend most of the day outside.
Well, I'll tell you, it's wonderful to see you up and around again.
I can't believe the difference.